Hello, everybody. Hope you all are fine and enjoying a good state of health. The topic for discussion today is the arches of the foot part 2. At the end of this session, the participant should be able to describe the mechanism for the maintenance of each arch, that is medial longitudinal arch, lateral longitudinal arch, transverse arches, that is anterior and posterior, and list the function of arches of the foot, and finally give a brief review of the applied aspects of arches of the foot, that is pes cavus, pes planus, hammer toe, and club foot. The integrity of an arch is maintained by number one, wedge-shaped stones which make up the major portion of the arch, with a more wedge stone at the top of the arch which is named as keystone. Number two, staples which hold the adjacent stone tight together and don't allow them to be separated. Number three, tie beams which connect the ends of an arc and prevents pillars from separation and sagging. And number four, multiple supports in the shape of suspension for bridge. These supports suspend an arch from a cable above the level of the bridge. Now, keeping these factors in mind, integrity of each arch of the foot, the factors for this integrity can be divided into three categories. Number one, shape of the bone, which comprises the bony factor. And number two, staples and tie beam, which comprise ligament and short muscles. And the third one, suspension for bridge, which is provided by muscles acting on the arches. Now we apply these facts being considered for the maintenance of medial longitudinal arch. Talus acts as the keystone, whereas interosseous ligaments, short plantar ligament, and tendon of tibialis posterior by its expanded insertion act as staples. Plantar aponeurosis, long plantar ligament, flexor digitorum brevis and longus, flexor hallucis brevis and longus, and abductor hallucis perform the function of the tie beam. And the tibialis anterior and tibialis posterior, along with medial ligament of the ankle joint, perform the duty of the suspension of the arch. For medial longitudinal arch, the bony factor plays a negligible role. Only bony factor which can be helpful in the maintenance of medial longitudinal arch is head of the talus, which rests on the sustentaculum tali of the calcaneum bone. Among the ligaments, plantar aponeurosis, which extend between the two ends of an arch, acts like boasting of an ARCHES arch and does not allow two ends to get apart. Number two, spring ligament, which extends between calcaneum and navicular bone and support the head of the talus. It does not allow the arch to fall and thus help in the maintenance of this arch. Number three, long plantar ligament, which connect the calcaneum with the cuboid and second to fifth metatarsal, is one of the main factors for the maintenance of this arch. Third component for the maintenance of medial longitudinal arch is the muscles. Flexor hallucis longus and flexor digitorum longus support the anterior part of the arch as they are present anterior to the sustentaculum tali. Hence, they are not active in standing posture, as most of the body weight is borne by the calcaneum. Anterior part of the arch bears more strain during forward propulsion, hence endured by these muscles. Among the two, flexor hallucis longus, which is a bulky muscle and whose tendon extends almost between the two ends of the arch, is considered as the most important factor for the maintenance of medial longitudinal arch. Among the short muscles, the muscles which are attached into first three metatarsals are abductor hallucis, flexor hallucis brevis, and flexor digitorum brevis. All these are considered to be um, one of the major factors for the maintenance of medial longitudinal arch. Peroneus longus and tibialis anterior muscles, because of their insertion and especially the travel of traveling pattern of the peroneus longus from lateral to medial. These both muscles form a strip which suspend the arch from above. Notable point is that ligaments provide the passive support and the muscle provide the dynamic support. For the maintenance of lateral arch of the foot, cuboid plays the role of keystone. Long and short plantar ligaments and short muscles of the foot plays the role of staples. Plantar aponeurosis, flexor digitorum brevis and longus, their lateral parts and abductor digiti minimi act like the tie beams. And the peroneus longus and brevis act like the suspension bridge of the arc. A minor part is played by the bone. Among the ligaments, short and long plantar ligament and lateral part of plantar aponeurosis act like passive bowstring to keep the ends of the bone, ends of the arc in place. Among the muscles, peroneus longus is the major muscle which passes medially through a groove on the undersurface of the cuboid and reaches the medial end and form a stirrup in combination with tibialis anterior and hence plays the role in maintenance of the lateral longitudinal arch as well. Peroneus brevis, which is inserted into the cuboid bone, plays a role in the maintenance of the arch. Among the short muscles of the foot, which are inserted into lateral two metatarsals, abductor digiti minimi and flexor digitorum brevis are also involved in the maintenance of the lateral longitudinal arch of the foot. Now we come on to the transverse arches of the foot. These are anterior transverse arch and posterior transverse arch. The anterior transverse arch is formed by heads of all the five metatarsal bones. Medial end of the arch is formed by head of the first metatarsal and lateral end by the fifth metatarsal head. Both these ends come in contact with the ground, hence this arch is a complete arch. As regard the maintaining factors, bones are not much involved in the formation of in the maintenance of the anterior transverse arch. Among the ligaments, transverse metatarsal ligament, which binds the heads of the metatarsal, is one of the major factors for the maintenance of the arch. Among the muscle, one major factor for the maintenance of this arch is transverse head of the adductor hallucis muscle. The posterior transverse arch of the foot is formed by three wedge-shaped cuneiforms and bases of the metatarsals. Deep transverse ligament and other plantar ligaments, along with the short muscles like dorsal interosseous and adductor hallucis, play the role of the staples. The tendon of the peroneus longus, which travels from lateral to medial along the inner lower surface of the foot, acts as the tie beam. Peroneus longus and peroneus brevis also act as the suspension ropes of the arc. As regard the maintenance, the wedge-shaped cuneiforms are to play the part in the maintenance of the arch. Interosseous ligaments, plantar ligaments, and dorsal ligaments are among the ligaments which bind the three cuneiforms and bases of the five metatarsals and play their role in the maintenance of the arches. Among the muscle, peroneus longus, which crosses from lateral to medial side and along with the tibialis anterior, forms a stirrup as explained in the previous slides, and this stirrup helps maintain this arch as well. Peroneus brevis, being attached to the lateral aspect of the arch, also acts on it from above. As regard the function of the arches of the foot, these arches determine the weight-bearing spots of the sole. They help in walking and running. They act as shock absorber in walking and running, and the concavity of the sole protects the soft tissue of the sole as well. In applied anatomy, first the normal arches of the foot. Foot in medial view shows moderate curve of the sole, and in footprint, middle part of the arch is about half filled. This arrangement provides a balanced distribution of weight across the foot, hence least chances of wear and tear. Number second is pes cavus or high arch, which is also named as hollow foot. There is excessively high arched foot. Sole is distinctly hollow and footprint shows more concavity. The foot is relatively stiff when bearing weight, reason being a neurological disorder such as poliomyelitis and Charcot-Marie-Tooth disease. In such cases, peroneus longus is overactive, which causes plantar hyperflexion of first metatarsal, which results in hindfoot varus, in which the calcaneus is adducted and rotated under the talus. Third is pes planus, flat foot or fallen arch. This variety is a relatively common foot deformity, and one of the fast bowlers of the world, Mr. Shoaib Akhtar from our country, was the one of the fast bowlers who was suffering from the pes planus or flat foot. In this condition, there is loss of medial longitudinal arch so that the foot contacts or nearly contacts the ground. Footprint shows less or no concavity at all. This abnormality causes pain and stiffness of the foot, and more chances of wear and tear. Hammer toe is a deformity of second or third or fourth toe. The involved toe is bent at middle joint and resembles a hammer, and the toe moves into a claw-like position. Initially, hammer toe is flexible, but extension in this condition is quite painful. If left untreated, muscles and tendons become tighten and come to be shorter and ultimately become fixed. When this happens, the correction of this deformity requires surgery. Most common cause of this deformity is wearing short, narrow, and too tight shoes, which causes the toes into a bent position in the shoe. Next is the club foot. This deformity has got four components. These are midfoot cavus, forefoot adduction, heel or hindfoot varus, and hindfoot equinus. These deformities are mainly due to tightness of tibio-navicular ligament, tightness of tendons of extensor digitorum longus, tibialis anterior, and extensor hallucis longus. These tightnesses are accompanied by shortened Achilles tendon, which is also named as fixing the foot in equinus, which causes plantarflexion at the ankle joint. And ultimately, foot turns in and under. Clubfoot is twice as common in boys as compared to girls. Comments and suggestions will be welcomed. Thank you for listening and watching.